Wondering how an intrauterine device, IUD, is inserted? The entire procedure takes just 60 seconds. When it's time for the procedure, you'll lie on an exam table. The healthcare provider will gently insert a speculum to see your cervix clearly, then clean the cervix with an antiseptic. This step may cause slight discomfort, but it's usually short-lived. Next, the provider will measure the depth of your uterus with a small tool to make sure the IUD fits properly. Then comes the insertion part. The IUD is first placed in a thin tube, which is gently guided through the cervix into the uterus. Once in place, the IUD is released and expands into a T-shape to stay secured. The procedure is quick, but you may feel abdominal cramps or pressure afterward. The provider will trim the IUD strings. You can check these strings regularly to make sure the IUD is in place. Mild cramping after the procedure is normal, and some people may still feel discomfort a few days later. Don't forget to follow up for a checkup in a few weeks to ensure everything is okay. Have you ever had this experience? Feel free to share your feelings in